A number of Ugandans were recently struck by the news of Global Fund cancelling financial assistance to the 3 programs of HIV/AIDS, malaria and tuberculosis. The Uganda Country Coordinating Mechanism for Global Fund, the in-country Global Fund body led by its chairman, Professor Vinod Natulia, submitted requests to secure the periodic fund. They have now successfully secured a total of $792 million towards facilitating activities of the HIV/AIDS, malaria and tuberculosis programs.
And what is pleasing is that the technical review panel had this to say, that the technical review panel considers the funding requests to be technically sound and strategically focused.
Over $541 million is committed to fighting TB and HIV, while the rest of $250 million is to energize the campaign against malaria from 2018 to 2020. Dr. David Khumro Apoli, a board member for the Eastern and Southern Africa constituency of the Global Fund, says strengthening health systems will be key in the next grant, something that had hindered total absorption of the Global Fund money.
Strengthening procurement, supply chain management, strengthening data collection, strengthening the human resource.
This amount, however, is a drop in the ocean in funding HIV/AIDS, malaria and tuberculosis programs, posing a big challenge in containing the 3 epidemics.
If you take, for instance, HIV/AIDS, the National Strategic Plan reports that we will need $3.7 billion to effectively implement the HIV/AIDS response for the financial year 2015-16 up to 2019-20.
The Permanent Secretary, Minister of Health, Dr. Diana Twine, says her ministry is committed to ensure the money is not mismanaged.
I think it also calls for more vigilance, that this money is utilized more effectively, more efficiently to give us the results. So that
as Global Fund renews belief and commitment to support Uganda, government is called upon to increase counterpart funding towards the 3 diseases of tuberculosis, HIV and AIDS, and malaria to step up absorption for the grants to make a meaningful impact on the lives of Ugandans. Statistics from the Ministry of Health show that malaria is still the leading cause of death in Uganda, accounting for over 27% of deaths. A 2015 report by Uganda AIDS Commission indicates that 83,000 Ugandans get infected with HIV annually, translating to 230 persons per day, with the national prevalence standing at 7.3%. While that of Uganda National Tuberculosis Prevalence Survey indicates that over 90,000 tuberculosis cases occur annually. Dr. Skimonan Banadiga, UBC News.